Around 1700 BC, an Egyptian medical papyrus documented a recipe of ground acacia leaves and linen. It was a treatment for a painful internal swelling that physicians have been tracking for millennia. By 460 BC, the Greek physician Hippocrates was recording his own surgical interventions, using woolen thread to manually restrict circulation to inflamed tissue. Medieval scholars and philosophers continued this work across cultures. Treatises from physicians like Maimonides were dedicated entirely to documenting the progression of this specific anatomical failure. These records reveal a universal experience. Hemorrhoids are an ancient human vulnerability, existing independently of modern societal stigma. This diagram identifies the healthy anal canal. Everyone is born with vascular cushions, essential structures providing sphincter control. Built for routine movement, they are vulnerable to gravitational pressure. Modern habits like low-fiber diets, constipation, and prolonged sitting create a heavy load, causing these cushions to distort. Under extreme mechanical strain, the blood vessels swell. Connective tissues lose elasticity, reaching a physical breaking point where they cannot return to their original shape. This condition is a predictable physical breakdown. Normal anatomy simply yields when the internal pressure exceeds the structural limits of the body. This structural collapse occurs in two distinct anatomical zones, each following its own mechanical path. External hemorrhoids form under the skin near the anal opening. When the vessels here swell, they can develop thrombosed clots, localized pools of blood that create acute, intense pain and inflammation. This schematic demonstrates the internal progression. At grades 1 and 2, the vascular cushions swell and slide down the anal canal, though they still naturally retract after the pressure of a bowel movement is removed. Continued stream leads to grades 3 and 4. At this stage, the mechanical damage is permanent. The tissue remains displaced outside the canal, having lost the structural integrity required to retract. The level of discomfort experienced by the patient corresponds directly to this observable path of tissue displacement. When lifestyle adjustments can no longer compensate for this tissue damage, medical intervention provides a targeted way to reset the mechanics of the area. Rubber band ligation is a primary tool for internal cases. A microscopic elastic band is applied to the base of the node to restrict blood flow, causing the damaged tissue to wither and shrink within a few days. Other methods utilize thermal or chemical energy. Sclerotherapy and infrared coagulation cause the walls of the damaged vessels to collapse, forcing the tissue to constrict and return to a manageable size. In advanced grade 3 or 4 cases, surgery is used to physically remove the permanently displaced sections of tissue, restoring the canal to its baseline state. Modern medicine addresses the issue through precision, using these tools to specifically disrupt the cycle of vascular failure. The availability of these treatments is often overshadowed by the societal embarrassment that prevents patients from reporting their symptoms. When symptoms go unaddressed, the mechanical failure worsens. Minor inflammation can escalate into chronic blood loss, leading to anemia or the strangulation of displaced tissue, which creates a critical medical emergency. This historical documentation shows a long-standing medical urgency to identify and treat these advanced anatomical diseases before they cause permanent systemic harm. The window for non-surgical routine care often closes during these periods of silence. Delaying intervention transforms a manageable structural issue into a complex medical crisis. Recovering from this condition relies on supporting the body's natural mechanics to prevent future failure. This requires consistent lifestyle maintenance, increasing dietary fiber to soften stool, maintaining high hydration levels, and ending prolonged toilet straining. These changes remove the unnatural downward load. Without constant pressure, the pelvic floor functions smoothly, maintaining a healthy, rhythmic flow through the vascular network. Epidemiological data shows that up to 66% of people will face this anatomical challenge at some point in their lives. Addressing this condition is a standard requirement of maintaining the human body, a mechanical process of understanding, managing, and restoring physical balance.